Welcome. Today, we're diving into something that sounds straight out of science fiction: surgeons who are literally rewiring the human body. We're going to see how a muscle from your leg can get your hand working again, how a debilitating condition is finally being conquered, and get this, how AI is helping to call the shots. Let's jump in. So, here's the game plan. First, we'll look at an absolutely incredible procedure for rebuilding arms. Then we'll get into the fight against a really tough condition called lymphedema and uncover a surprising link it has with pregnancy. And to wrap it all up, we'll see how artificial intelligence is stepping onto the scene to predict the future for both doctors and patients. I mean, seriously, just think about that for a second. It sounds impossible, right? Like something from a movie. But this isn't science fiction. It's a real surgical procedure that's giving people back the ability to use their own hands. So how on earth does it work? All right, let's get right into our first big topic. We're talking about the art and the incredible science behind something called functional muscle transfer. So what is this exactly? Well, you can think of it like a hyper-specialized transplant, but you're your own donor. Surgeons find a healthy muscle that your body can spare, and they carefully move it, along with its own personal power cord and plumbing, that is, its nerve and blood supply, to a new spot to take on a brand new job. It is quite literally rewiring the body's own hardware. Now, this is where it gets really interesting, because surgeons have to make a big strategic choice. Based on the work of Dr Shabri Girish, they often prefer the gracilis muscle from the thigh. Why? Because its nerve and blood vessels are nice and long, making them easier to hook up. But if the patient needs more power, they might opt for the rectus femoris muscle instead. The trade-off is that taking that muscle has a bigger impact on the leg. It's a real balancing act between restoring strength and ensuring a smooth recovery. And look, this isn't just some experimental thing in a lab. This procedure is genuinely changing lives for people with really severe conditions. We're talking about things like brachial plexus injuries. That's when the critical bundle of nerves from your spine to your arm gets damaged. It's also a game changer for conditions like Workman's ischemic contracture, where the muscles in the forearm have been damaged because they lost their blood supply. So how do they actually pull this off? The surgery itself is a masterpiece of precision. First, they carefully remove the donor muscle. Then they move it to its new home in the arm. But steps 3 and 4, that's where the real magic happens. They have to meticulously reattach tiny blood vessels under a microscope to bring it back to life. And then they connect its nerve to a nearby, working nerve so the brain can eventually learn to control it again. Just incredible. Okay, so we've seen how these techniques can rebuild a limb. Now, let's pivot and see how similar principles are being used to tackle another huge medical challenge. We're talking about a condition called lymphedema, a really debilitating swelling that, for a long time, has been incredibly tough to treat. First off, let's get on the same page. What even is lymphedema? Well, imagine your body has this amazing internal drainage system called the lymphatic system. It keeps fluids moving. But what happens when that system gets damaged or clogged up? The fluid has nowhere to go. It builds up, causing this chronic, painful, and often severe swelling, usually in the arms or legs. So what's in the surgeon's toolbox for fighting this? Well, according to data from Professor Isao Koshima, it's not a one-size-fits-all solution. For about half the patients, liposuction is the main approach, to just remove the built-up tissue. But for others, surgeons perform these incredibly complex vascular channel transfers to create brand new drainage routes for the fluid. And often, it's a combination of different techniques staged over time. And you might be wondering, does all this complex surgery actually work? The answer is a resounding yes. Check out this number, 72.2%. That's the success rate for achieving excellent or good outcomes with this staged approach. For a condition this stubborn, a number like that is a huge beacon of hope. And just to be clear, we're not talking about a small, barely noticeable improvement here. The goal is life-changing results. Take this one case from the study. The patient saw a 42% reduction in the volume of their limb. Can you even imagine the relief? The freedom of movement that gives back to someone? It's phenomenal. Okay, this next part is honestly really surprising. We're going to zoom in on a very specific group of patients where lymphedema shows up in a unique and pretty unexpected way: during pregnancy. This quote from Professor Koshima really hits home. He points out something that's so easy to miss. What might just look like normal, mild swelling during pregnancy could actually be the first sign of a chronic problem, a problem that can get much, much worse with future pregnancies or weight gain. So what's the deal here? Why is this type so different? Well, for one, it's sneaky. It often looks really mild at first. Researchers also think it might be tied to the body's own immune reactions during pregnancy. All of this just highlights how critical it is to catch it early and intervene, ideally before a woman has a second child, to stop the condition in its tracks.
All right, for our final section, we're taking a leap into the future. This is where the operating room meets big data, where human skill gets a powerful boost from artificial intelligence. We're talking about the dawn of truly personalized treatment.
This is a real game changer. Instead of just going on past experience, surgeons are now feeding massive amounts of patient data into AI models. The AI acts like a super detective, sifting through hundreds of variables to find hidden patterns that can help predict which patients are the best candidates for surgery. So, what did this AI super detective uncover? What are the secrets to a great outcome? Well, it zeroed in on a few absolutely critical things. It confirmed that getting surgery in the early stages is key. It showed that keeping weight stable after the operation is vital. It also found that combining different surgical techniques is often more effective. And, fascinatingly, it even revealed that the health of a woman's lymphatic system before she ever got pregnant plays a huge role. And the best part? This isn't just some academic paper sitting on a shelf. The researchers turned all this data into a real practical tool, a new scoring system. This lets doctors calculate a patient's chances of success before they even schedule the surgery. It helps everyone manage expectations and, more importantly, helps tailor the treatment plan to be perfect for that one individual. And that brings us to a mind-blowing final thought. We've seen surgeons literally rewire the body, and we've seen AI start to predict the future. So the real question isn't if technology will change surgery anymore, it's how fast and how far it can go. Are we on the verge of a time when an AI could analyze a patient and design the perfect, completely personalized surgical plan from the ground up? The journey is just beginning,